Thank you, Laurie. We really appreciate the opportunity to be on and present this evening. And we're going to talk about the Remedē System, which is a novel therapy for, as you said, central sleep apnea. And we should have plenty of time for questions at the end. So I'll just kind of jump in and get started.
And if you guys do have a question, just go ahead and put it in the Q&A or the chat, and we'll go over them at the end. I'll be here on standby.
Great. So this is the fine print, if you will. We're going to talk about the Remedē System, which is indicated for the treatment of moderate to severe central predominant sleep apnea in adult patients. There are a couple of contraindications to getting Remedē, and one is the need for ongoing or continuous MRIs. At this point, the Remedē System is not labeled by the FDA to be compliant with MRIs. That is something that we are working on as we go forward. And there are some patients who, because of certain diagnoses, know they're going to have an MRI, X-ray once a year or twice a year. And so those patients would not be great candidates at this point. And the other contraindication, as with any surgical or implanted device, is that you can't have an active infection when you get the procedure. So with that, we'll just jump into talking about what Remedē is. Remedē is an implantable device that stimulates one of the nerves in your chest to tell your diaphragm to breathe at night. And again, it's used for the treatment of central sleep apnea, which we'll talk about is very different from obstructive sleep apnea. Remedē is made by the Respicardia company that has been around about 12 or 13 years now, really studying and researching this technology and bringing it to market. So let's talk a little bit about central sleep apnea. A lot of people have heard of sleep apnea, and specifically what they've heard of is obstructive sleep apnea. It's actually much more common than central sleep apnea, and this is caused by an obstruction in your upper airway. So your mouth, the soft tissues in your neck or mouth or your tongue can fall back as you relax and go to sleep and actually block the movement of air. But central sleep apnea is a disease process in which the signal from the brain to your breathing muscle is lost, and the area that controls breathing is affected so that the signal doesn't get from your brain down to your nerve and your diaphragm to take a breath through the night. As I said, if you look at everyone who has sleep apnea, it's much less common than obstructive sleep apnea. However, in some patients, particularly those with heart failure, atrial fibrillation, other heart diseases, or some people who have had strokes, or brain injuries, or people who live at high altitudes can be much more susceptible to central sleep apnea. I have a video here that kind of gives you a graphic idea of what central sleep apnea is and then how the Remedē System works. So as you can see, the Remedē System is implanted typically in the right side of the chest. And the reason for this is that many of our patients have already a pacemaker or a defibrillator for their heart issues because, as I said, those are patients who commonly have central sleep apnea. So our device is placed very similarly to a pacemaker. In fact, it's placed by the same type of cardiology physician that places certain types of pacemakers. And a lead or a wire is cannulated and run right by this nerve that tells your diaphragm to breathe. So I'm going to start the video. Episodes of apnea while you're sleeping. I won't bore you with a whole lot of research and data.
I'm sorry to stop you. The video sounded like a code blue card. I didn't hear any, I heard like a loud noise. Maybe it was just my computer.
Oh, it didn't have any sound. I just talked over it. I don't know why it had.
We couldn't hear you talk. Laura, could you hear her? It's okay.
No, we couldn't hear you.
Yeah.
Very weird.
It was a loud noise on my end. Maybe.
Wait, let me try. Okay, let's try. Okay, let's try it again and just stop me if the noise starts.
Okay, that's better. Go ahead and walk us through it again.
Oh.
We can't hear you, Missy.
Yeah, we can't hear you. Yeah, it's not allowing her voice to play over the top of the.
Impulse that is just like a breath.
Okay.
And it doesn't.
It didn't work. So maybe just don't play the video. Just tell us what the video shows.
Okay. Okay. Sorry. All right, let me get to this. But now you can hear me, right?
Yes.
Okay, my apologies, everyone. So the device is implanted again by a cardiologist who specializes in pacemaker placement. And the device consists of this pulse generator that is the battery and the working part of the device, and then a stimulation lead that comes right by this phrenic nerve that I was showing you. And this is the nerve that typically carries the impulse to breathe from your brain to your breathing muscle, the diaphragm, which is this muscle across the bottom of your lungs here. So the therapy comes on at night. We'll talk specifically about that in just a little bit. And it stimulates the diaphragm through interacting with this nerve, and it delivers a stimulation that's very similar to a normal breath. In fact, it takes over breathing at night and completely takes away these central apnea events when you just stop breathing. My apologies again for the video problem there. So again, a couple of slides. I think the research is important to know how much the device has been studied. The Remedē device was approved by the FDA in October of 2017 after a trial that we call our pivotal clinical trial. And the bar on the left just shows patients, the pool baseline of all the patients at the beginning. And they had an average apnea-hypopnea index of 49. And the orange shows that most of their apneas that they had during the night were central apneas, where they didn't get the signal to stop breathing. And then you could see with Remedē treatment all the way out to 24 months, complete resolution of the central apnea. The teal or turquoise bar is obstructive apneas. A lot of patients have a little bit of obstructive, a lot of central. Some patients have a little bit of central and a lot of obstructive. We don't treat the obstructive, but as you can see, we do treat the central, and we have some patients now who have had, gotten other options if they had a lot of obstructive events remaining. So this is looking at what the Remedē device did for patients' quality of life. Did it make them feel better during the trial? And this is 80% of, just over 80% of patients saying they had some improvement in their quality of life. And most of them, 60% of them, had significant or moderate improvement in their quality of life. So they felt better during the day. They were less fatigued, less sleepy, able to think more clearly, and do more of the things that they wanted to do every day. And then we asked patients at the end of our trial, as they were exiting the trial when the study was over, if everything you've known now, would you elect to have this procedure again? So having the implant, the procedure, working with the device to get it optimized, would you go and have this procedure again? And 95% of the patients in the trial said yes, we would repeat the procedure again. And then the last slide from our study is just the safety of the trial. 97% of patients had successful implantation of the Remedē device. 91% of patients free from adverse events. The adverse events that we did see were very similar to all of the pacemaker and implantable defibrillator trials that we've seen in the past in the cardiology world. So these were maybe a problem with the incision, an infection, the lead or the wire may have moved and had to be replaced, but no long-term detrimental effects at all from the implant or having the Remedē therapy. So moving on from the trial data, let's talk a little bit about what patients ask and how Remedē works. So how does Remedē turn on at night? Remedē is completely automatic, so there's nothing that you need as a remote control or anything on your bedside to activate the device. About 1 month after the implant, patients will come into the clinic, either your sleep physician or a cardiology clinic, and we will look at the device, and the device is able to tell us when you sleep and how you sleep, what positions, how much you roll over, how much do you get up at night. And we use that information to program the device to come on. And once the device is programmed, every night when it's nighttime and in your normal sleeping time, which is customized, so let's say for this patient, it comes on at 11 p.m. and it goes off at 6 a.m. So every night it looks to detect, is it the appropriate sleeping window? Yes, it's 11 p.m., it's time to come on. And then it looks to see if the patient is in their normal or programmed sleeping position. And this is important because a lot of people can't sleep laying completely flat, and the device doesn't require that. A lot of patients sleep on 2 pillows or 3 pillows, or you may sleep with your bed propped up with the head raised, and the device, all of that is programmed within the device. So every night it looks, is it the right time of day? Are you in the right position? And are you not moving? And when it senses all 3 of these things, it determines that you're asleep, and it begins to slowly deliver therapy. And as I said, it really kind of comes in and takes over your breathing and takes care of your breathing for the whole night. So the therapy is paused anytime that a patient sits up. So if you get up to go to the bathroom, let's say you're laying in bed at 11:30 and you're doing a crossword puzzle, but you're laying almost flat and you're not moving enough for it really to detect that, and you feel the therapy come on, it doesn't hurt. It just feels like something's making you take a breath. You can simply sit up and it will pause the therapy. Or anytime a patient rolls over in bed at night, if you're just trying to get comfortable, or sometimes you wake up and then you switch positions to go back to sleep, the device senses that and it pauses therapy for a pre-programmed amount of time that we can actually customize. So if you fall asleep in just a couple of minutes, we want the device to come on within that time frame, 3 or 4 minutes. If it takes you longer, we'll let it pause longer. And the reason for that is a lot of these events where your oxygen concentration goes down or you stop breathing can happen in the early stages of sleep. So we want the patient to have therapy for as much of the night as their sleep. So the next question that we hear a lot is, what does Remedē feel like, and does it hurt? So I'll read these quotes from patients, but I will say that I've never had a patient tell me that the Remedē device hurts. They say it feels like someone's making you take a breath, or it feels like the breath that you take right before you go underwater and that you didn't really mean to take it. A lot of our patients actually like to feel it come on, so they'll get quiet and lay in bed because it gives them the peace of mind that it's working and it's breathing for them. But most patients just get really comfortable and start breathing with it, and it does not wake them up. That is our goal for the therapy, not to wake you up, because if we wake a patient up every night, we are not really treating anything. So from some of our patients, the first time I felt the stimulation, it felt a little different, but it wasn't uncomfortable. The breath felt natural, but it was different. It was a different sensation to know that the device was telling my body when to breathe. I just relaxed and let it work. And I hear that last part a lot. And then another patient, it felt funny at first, feeling my diaphragm rise without me telling it to, but now I barely even notice it. I usually lie in bed for a while before falling asleep, so I often feel it come on, but I don't even think about it. It's almost a natural thing now. And then another one, at first I could feel it. I tend to breathe more slowly, so the device needs to be tailored for me. I just let them know what I was feeling and they reprogrammed it. So some people have a deeper inspiration and a longer expiration or vice versa. And we can actually tailor the therapy, the stimulation that the Remedē device delivers to really customize with how a patient breathes and make it very specific for you. What is the process if I'm a candidate for Remedē? So we're just going to kind of go over this at a little bit of a high level, and then we can do more specific questions or talk about how to get more information. The first thing you will have is a sleep study, and this is typically a sleep study in a sleep lab where they can really measure all of your sleep metrics and determine if you have predominantly central sleep apnea. Many patients may be tried on CPAP or another type of mask before moving to Remedē therapy. There are some particular heart failure patients who aren't candidates for some types of mask therapy used to treat central sleep apnea, but most patients are tried at least for a short period of time on a CPAP or other type of mask because they may tolerate it well and it may completely treat their sleep apnea. Many patients can't tolerate the mask or the pressure, or it doesn't help all of their central sleep apnea and they're still having apneic events. At that point, your physician may talk to you about Remedē as an option. Then you're referred to a cardiologist who does the Remedē implant, and they'll typically see you in the office to make sure that you're a good candidate for the actual procedure. The procedure is done either in a hospital in a cardiac or heart catheterization lab, much like a pacemaker or a heart catheterization, and that could be done in a hospital heart lab or in an ambulatory surgical center heart lab. It is an outpatient procedure. Occasionally, you will stay overnight. Many patients go home the same day. During the procedure, we will test the device. If you have a pacemaker, we will test the pacemaker and the Remedē device to make sure that there's no interaction or no signals getting crossed with the stimulation. Again, about 1 month or so after your Remedē implant, you'll come into a clinic office, and this could either be a sleep medicine clinic or with a sleep physician, or it could be in a cardiology device clinic, and have the therapy activated and evaluate how you've been sleeping for the month, and again, customize the therapy based on that information. Then over the next several months, you'll come back to clinic about every 6, sometimes 8 weeks or so, and we'll look at the device, see how you're feeling, and really customize and titrate the device so that it's the most comfortable and the most effective at treating all of the central apneas. We're able to look at effectiveness. We're able to look to see if it comes on too early, you're going to bed a little bit later than we thought you did, or you're going to bed earlier and we're missing some events because the device isn't programmed to come on until later. A lot of patients like to wake up slowly in the morning and they're awake and they kind of lay in bed and just kind of wake up over a little bit of time. So we may make the therapy cut off a little earlier than when you actually get out of bed. So we, again, really customize it over several visits. And then once it's customized, you may have either a home sleep study or a sleep study in a sleep lab to make sure that the device is completely treating your sleep apnea and it doesn't need to be tweaked or titrated anymore. And at that point, the follow-ups get much longer, 6 months. I think we have some patients that are being followed up once a year just to look at the battery, make sure everything's going well, and make sure that you're feeling well. Our website is respicardia.com, and there's a lot of good information there. The video that I couldn't get to play is on there with some subtitles, so you could look at that, as well as a similar video just showing how the signal is lost in patients with central sleep apnea. You can also take a survey and ask our nurse liaison who works with us every day for more information if you're interested. So again, that's www.respicardia.com. And that's all I have slide-wise, Laurie. Wanted to save some time for questions and see what thoughts people have.
Yeah, thank you. So interesting. So let us know if you have any questions. There is one here. It is the unit compatible with spinal cord stimulator used for pain?
Yes. Yeah, we do have some patients with both devices. We do have patients with other types of neurostimulators as well. The device only delivers therapy at night, which is one reason that typically there's not any interaction or issues. I don't know of any issues that we've really had to date with those devices.
All right, great. Does anybody else have any more questions?